It's National Diabetes Month, and for today's Health Watch, we are talking to Dr. Celine Gounder about a new report showing the rate of diabetes globally, how it has doubled. Type 1 and type 2 diabetes rates among women and men rose from approximately 7% back in 1990 to about 14% in 2022. The largest increase of all was in low and middle income countries. Diabetes can cause serious health problems throughout the body, including kidney failure, blindness, and heart disease. As I mentioned, CBS News medical contributor Dr. Celine Gounder, editor-at-large for Public Health at KFF Health News, joins us now to talk about this. What's the explanation? Why the rate's rising?
Well, the U.S. has done a really great job of exporting our culture, our music, our movies, and our ultra-processed food. And so this is really a reflection of people's diets changing, and it's the exact same drivers of diabetes and obesity in our country. People have also become more sedentary in their lifestyle, so maybe they're not doing as much physical activity on the job. And then you have certain ethnic groups that are at higher risk for developing type 2 diabetes, people from South Asia, Latinos, certain indigenous groups.
I keep hearing about people that have it and don't know that they have it. So are there some early signs or are there warning symptoms that you should look out for?
Well, this is a really good point, and this is why it's important to be going to see your primary care provider on a regular basis. There is a very simple blood test to diagnose diabetes, and by the time you have symptoms, you've already had diabetes for a while.
Okay.
So some of the symptoms you could have are blurry vision. You might notice that you're drinking or peeing more, maybe numbness and tingling in your fingers and your toes, but that means you've probably already had it for a while.
All right, so what's the difference between type 1 and type 2?
So type 1 diabetes is an autoimmune disease. So your immune system is turning against the pancreas. That's the organ that makes insulin in the body. So we treat it with insulin because you have a deficiency of insulin. Type 2 diabetes is insulin resistance. So your insulin that you're making is not working as well. So we can treat that by giving extra insulin, or we can treat that with medications that reverse that insulin resistance.
How do you reduce your risk of the type 2 type of diabetes? How much of it is exercise? How much of it is diet?
Well, it's all of it. So it's healthy eating, staying away from the ultra-processed food, trying to eat a diet rich in vegetables, fruits, lean proteins. Exercising matters, even if it's just walking. And the healthy weight is important because it's that fat around the abdomen that's what we call metabolically active that causes the type 2 diabetes.
What about the people, we keep hearing about people using it for weight loss, but it was originally supposed to help people for diabetes. What can you tell us about the connection there?
Yeah, so Ozempic is and Zepbound, some of these medications are effective for type 2 diabetes, but one concern is a lot of people have side effects and need to stop within a year.
Dr. Celine Gounder, we appreciate your valuable information.